What are your thoughts about artificial intelligence, coming into the healthcare space?
I would be foolish to not utilize AI in my practice. I'd be foolish to do that. The one concern that I do have is what we've kind of seen already in medicine is that people become so dependent on the tool, they now eliminate the need for actually speaking with a specialist or speaking with a physician who's board certified. You're the expert in your body. I'm the expert in being a scientist. I'm an expert in being a physician. And the two of us together now will be able to come up with a plan of care. Our AI tools supplement that. Our AI tools will strengthen that relationship. Our AI tools will be able to get to our goal faster a lot of times. So when we're using one without the other, it doesn't make sense.
Hello, everyone. Welcome once again to Medical Practice Success Secrets. And I'm super excited because I have another great guest today, Dr. Sabine Elise. How are you today?
I'm doing great. How are you, Theo? So great to be here.
Oh, that is awesome. Well, if you don't know about this phenomenal physician, Dr. Elise is a speaker, Amazon bestselling author of The Health Whole RX. Dr. Elise is a board certified family medical physician, CEO and founder of Cornerstone Medical Group in Coral Springs, Florida. She is fellowship trained in hospice, palliative care, and holds a master's degree in public health with degrees from University of Florida and Nova Southeastern University College of Osteopathic Medicine. Her greatest passion is providing people with tools to make daily informed decisions about their health through patient education. Dr. Elise's uniquely approach to medicine is influenced by her training in both rural communities and metropolitan areas that place emphasis on patient advocacy. Sought after speaker at conventions, colleges, churches, and workshops, Dr. Elise is a respected physician known for her medical knowledge, brilliance, and compassion. Her contagious, warm smile welcomes all those who meet her and initiates a trusting patient physician relationship. That is so true. I mean, having that trusted relationship with patients is so key. When we kind of think about this, one of the things that came up when we kind of did our research, CDC reported that Black women in the US are 3 times more likely to die from pregnancy related causes than white women. How can primary care providers like yourself better address maternal health disparities in everyday practices?
That's such a great question, Theo. And when you think about that, it's very startling and it's unfortunate because these numbers actually are similar to what would be in developing nations. And
Mm.
that's something that should not just happen. So, number one, I think the most important thing, and I hate to say this, but it's the reality of it, each individual must take ownership of their own health. I cannot say that enough. I'm sure that we're going to get into it more, but this is the reason why, more than me personally, as a physician, being your advocate, I can only be your advocate when you are your advocate. So, the number one thing that I tell every patient, whether they're a Black woman, Black man, white woman, it honestly doesn't matter. More importantly, but what we see the most, who gets impacted the most, let's be real here, who gets impacted the most? The minorities, our brown and Black brothers and sisters, the socioeconomic status, those who have a lower income. Most important thing that you can do is make sure you have a physician who hears you, who listens to you, who takes care of you, and who advocates you. So, what does that look like in an everyday space? That looks like they're not making you feel shamed. They are not telling you or avoiding your questions altogether. It's a place that's welcomed. It's a place that you have an established relationship with. That is the most important thing because now that you get into the room with me, I can give you better understanding, particularly my pregnant women, help them understand what your baseline normal level is for blood pressure. Blood pressure is a big thing for people in general, but specifically pregnant women, particularly when we start speaking about eclampsia or preeclampsia. It's an experience that I have had personally with patients where they tend to have a lower blood pressure number. That's their norm. So when they actually go to the OB-GYN, when they actually get pregnant, a number that would be considered an emergency situation for everyone else is not considered that for them. Because their blood pressure is lower, they have to understand and know when their blood pressure looks like what would be a normal 120 over 80, that for them is an emergency situation because that's not their baseline. It's what I say all the time, that medicine is not one size fits all. We all have unique fingerprints. Our health is unique. So I would love, even like in these podcasts, even when I go live, even when I'm on social media providing information, I would love to give information that's one brushstroke and give you kind of an idea for everyone. But truly, it's just a bit of a guideline. The most important thing that individuals have to do is take ownership of their health. And that's why we see so many Black women, unfortunately, dying, leaving their families, leaving their children, leaving their husbands, leaving their spouses, leaving their significant others at early and quicker rates from something that should be eradicated in a country like the United States of just premature death, maternity death, and the numbers are startling. I wish I could tell you they're getting better, but they're not.
Mm. Yeah, I mean, I can remember Serena Williams, right? I think she had some issues with pregnancy and dealt with that. Track star Allison Felix, right, had similar issues, right, in dealing with that during pregnancy complications. My sister also had complications and had no other female friends as well, and so who all Black and suffering from the same issues, and sometimes some of that is also just uh, I think there was a study about physicians and not listening more to Black women when they're in pain and
Absolutely.
understand the concerns, right, and kind of mitigate against that. And so there can be complications from that as well. So I think those are some of the things that we're seeing that's becoming more important for physicians to kind of listen and understand the pain that comes from their patients, whether regardless of their race or nationality, and then to your point, kind of, making that priority to help them through that process. And you hit the nail on the head. It's just unfortunate that, people are dying in the first world where we can have all these medications and diagnoses and ways to treat people, but we're still running to these same issues over and over again. And so definitely, please speak out about that more and more because it's definitely unfortunate what's happening out there. When you kind of think about, the evolution of healthcare, you talk about, helping individuals in different areas. One of the things that stood out in your bio was your focus on rural health. We do a lot in rural communities, middle Georgia, and places in Texas and Arizona, even and Oklahoma. Rural healthcare, unfortunately, gets a bad rap, and so when you're kind of looking at what we can do for folks that are in those areas, especially with new innovations and technologies. What are some of the things that you're seeing as really effective in keeping those communities engaged in their own health, even if they can't see the doctor as often because of the distances?
Number one thing is there has to be education. It goes back to you have to know what's going on in your body. We can't take, we love it, but we can't take the advice of the neighbor. We can't take the advice of the niece that's a straight A student in high school and then took the science class. I mean, this is what we all do. The biggest necessity is that you have to ask questions, you have to be informed. And if you are speaking with any individual that is across from you, what be that the physician, be that the nurse, and you feel as though they're not answering your questions correctly, they're not telling you specifically what's going on in your body or what to pay attention to, what alarms, the signs and symptoms that your body is giving you that sometimes we just often ignore. Sometimes we often find a bush or a tea to boil, and then we utilize that, which is something that we just cannot ignore. We are a group of people who tend to nurture pain. That's something that we cannot do, particularly as it comes to our health. Our bodies are so unique and so beautifully created, but by who I think is the creator of the universe, God, that our bodies gives us the signs early on for you to be aware of. If you are unaware of what those signs mean because no one ever taught you, then that is going to be the biggest problem. There's also so many new modalities that are in place right now, known as remote patient monitoring. Unfortunately, some of those remote patient monitoring, they're not available to everyone. The same way that there is this real disparity of the haves and have nots, for some people, they have access to it. For the other people, they don't have access to it. Being that I did my residency in Belgrade, Florida, I don't know if you're familiar with that area. Oh, I see you shaking your head. Yeah. Those of you who may not be familiar with that area, this is the area specifically Their Eyes Are Watching God, Zora Neale Hurston's book was about. She spoke about this specific area. And I kid you not, and this was like, what year was I in residency? 2012 to about 2015. As I drove into the city of Belgrade, I felt like I was driving back into time, literally. I saw migrant farmers at 5 a.m. on the side of the road with machetes just waiting to be picked up to go into the field and cut cane. It's the shame. I saw individuals, well, first of all, also, people said y'all and folk. I didn't even know people still say y'all and folk when they speak in everyday language. But the other half of it, too, is that there's this thought process because there are people who live in a rural area that they can't learn or they're uninterested. My role as a physician is to dissipate that. Everyone can learn. We just need to speak to them so that they can understand. We can't speak medical jargon. We have to give an understanding. We could let the mechanic in that rural area help him understand that his congestive heart failure is if his car is trying to go up a hill, it can't go up that hill. He'll have that better understanding once we relate it. And that's why education, health education specific to you is so needed. I would like to say in the perfect world, that's what you're going to get no matter where you go, but it's not the case. You have to seek that out. You have to find it. You have to keep looking for it. And what I see has happened in the arena of health, what is common has become normal. Did you catch that? What is common has become normal. We think it's, even though it's common that people wait 2 hours to see their physician, people think that's normal. That's not normal. What's common is someone hands you blood work and says everything's fine. That's not normal. What's common is that they'll tell you, oh, you came the first time, your blood pressure was high, start this medication. That's common. That's not normal. Until our populations understand the baseline of what is normal, then they'll then have a voice to know what they should be asking for, how they should be treated, what they should expect, and what they should and should not accept.
People normalize things, with over time, with good or bad. And so, to your point, just because it's been consistent, common, we do need to break out of those habits and create a better sense of care for individuals. I did want to circle back to, you talked about remote patient monitoring. That's kind of my wheelhouse in my space. My company does a lot with remote blood pressure cuffs and scales and glucometer monitors and rural neighbors. As a matter of fact, one of the first things that we did was helping patients who had COPD, a pulse ox device, and then gave them a cell phone and with an app that were able to do their what they call their COPD assessment test. Which if they go certain thresholds, then that's likelihood of them being admitted back into the hospital. And there was a lot of undeserved communities in that area, in the rural area. We were able to help find issues before they even had an exacerbation and come back into the hospital. And I was able to lower the readmission rates, which are something the hospitals are trying to avoid, decrease. And so, to your point, I think CMS is starting to invest more into that. That's why they have reimbursable codes for RPM so that more physicians can try it out. But also, we're seeing payers also implement it on their own, right? Providing these type of services to patients because they see the benefit, right? And I think it's about, we're in America, people don't pay attention unless you're keeping score, right? In
Yep.
sports and in life. So if you have a device that's keeping score of what your blood pressure is consistently, and you have someone watching that, like your doctor or a caregiver, then patients tend to change their behaviors over time. What we've seen. We need to have more of that. Obviously I'm biased, but we need to have more of those programs out there, whether from grant or from funding from the government, because you're right, that can change behavior over time when people feel that connection to their doctor. That's so key for what you were saying about, having access to these type of tools. And then also, you're talking about individuals kind of utilizing home remedies, different things to kind of heal themselves. We just had a tragedy, unfortunately, with the young lady, Amanda Lewis, from MTV. Of people of a certain age remember her from Teen Summit and all those things from BET day, and she was trying to self heal, from breast cancer, and it was just unfortunate and not getting the care, that she needed. Maybe there was a sense of um, lack of trust, right, with the caregiver or the healthcare community. For her not to feel to need the help to get the help that she seeked. And so, one of the things that we kind of talk about as a framework from all the physicians I talk to is just like, we call it 3T framework. And look, I would love your input on this. We thought like this is the thing that I think a lot of times, physicians that have better connection and trust. First is, testimony. A lot of times if you kind of share your background and understanding, then that opens them up, right? And
Yeah.
then, once you kind of give that, that testimony, then it's be transparent, right? Saying,
Yeah.
hey, this is, things that I struggle with as well. And so sharing more of yourself can kind of eventually open up that trust to patients. And a lot of physicians seem to kind of, understand that and see that, because I heard, the toughest patients are doctors themselves. And so, having those kind of conversations with their physicians is to kind of help them will open up more patients. Because I've seen that with my own self with, talking to my own doctor when they kind of revealed more of their struggles, I was more willing to reveal my struggles as well. So those are some of the things, as a patient and as someone who is more of a practitioner, more of a assist to physicians. I see that more and more as we get into this new normal. Wow, there's so many interesting things. One thing I like to touch on briefly is just the change in healthcare. What are your thoughts about artificial intelligence? Coming into the healthcare space, right? I mean, the big thing right now is those ambient listening devices that are kind of listening while you're talking to patients and kind of coding things for you automatically. I mean, what do you see is going to change in how you deliver healthcare for the future with these AI tools coming to the forefront?
I think that when we think about AI in general, we have to understand that there is going to be just great capacity of what we're going to be able to learn and know. It's the very thought of being able to have internet and being able to go and just use all of these technologies to assist us. Those are the things that produce remote patient monitoring, right? This is the beautiful thing about it. The one thing we have to remember, though, it doesn't replace the years of experience that a physician has, and it does not replace the gut feeling of each patient. Something I tell my patients constantly is two things. One, you are the expert in your body. You may not believe that, but you are. Theo, you've been with your body longer than any one of us, right? You're the expert in your body. You have to pay attention to that. I'm the expert in being a scientist. I'm an expert in being a physician. And the two of us together now will be able to come up with a plan of care, come up to make sure that you're at your optimal health and the best well being. Our AI tools supplement that, they don't replace it. Our AI tools will strengthen that relationship. Our AI tools will be able to get to our goal faster a lot of times. The one concern that I do have is what we've kind of seen already in medicine is that people become so dependent on the tool that they now eliminate the need for regular care.
Mm,
They now eliminate the need for actually speaking with a specialist or speaking with a physician who's board certified. And then that puts them in a sticky place. So when we're using one without the other, it doesn't make sense. I
uh,
would be foolish to not utilize AI in my practice.
mhm.
I'd be foolish to do that. And at the same point, it would be foolish for a patient or any one of us to only utilize any of these monitoring devices or to only utilize any of the AI, because there's so many now, the scribing, the coding, there's so many to use that alone. Something that I've even noticed again, and this goes back to a little bit about that first question, right? When we speak about a patient who are pregnant women, and then unfortunately our Black women who are dying in higher numbers when it comes to premature deaths and pregnancy related complications. I made mention of one patient that I had specifically where I had to tell her and teach her, this is your baseline blood pressure. Your blood pressure normally runs at about 100 over 80. Anytime you see it at 120 as you're advancing in pregnancy, anytime you see it at 120, that is your alert to alert your physician or your OB-GYN. If that OB-GYN does not pay attention, you go directly into that hospital because you're now going into eclampsia. You're in preeclampsia and eclampsia. If she were to rely only on an AI tool, she wouldn't have known the difference. It would have never alerted that that 120 was abnormal for her. And this is what goes to something else I tell patients. We treat people, we don't treat numbers. We treat people, we don't treat numbers. In the same token, I have witnessed as well too, where a patient looks like their numbers are anemia and it's very low and they might need a transfusion. In residency, I'll tell you in full transparency, we ran and we transfused that person only, and it became detrimental for them because that was their
Mm.
base. It was their baseline. We have to know each individual's baseline. And that's why when we speak about just what I think is your most valuable asset, your health, it's a relationship, it's an understanding, it's a partnership, it's a collaboration. It almost is like a symphony of music that comes together, this care that you should have and this relationship that you should have with your physician. And it cannot be replaced. It cannot. I can't do what I need to do unless I have a patient. A patient can't do what they need to do unless they have an astute physician. And AI, we can't maximize the beautiful gifts that we can get from AI unless all of those players are incorporated.
No, you hit the nail on the head. I mean, the challenge of AI, it's amazing what it can answer, but a lot of times you don't even know what questions to ask it, right? And so that's where the human being can come in the middle of that, right? The expert who does know the questions to ask, right? Because that's the problem. You can, I was doing it this weekend trying to, dig down deep into a few things and it gave me some answers, but I knew that that wasn't the questions that I need to ask. I need to ask a different question, right? But if you don't have that base knowledge, and that's why having a physician there that can guide you in that path is so important. Because you're right, you've seen the rise of folks using AI to help for mental health, and with I mean, I'm glad they're trying something to get the help they need, but you're right, not having that guidance can probably lead them astray sometimes. And so I think I'm hoping we're not replacing the human need for experts with AI,
Right.
because we think we're the expert, but you're
Yeah.
not the expert asking questions. I think that's the thing people got to realize. You
Yeah.
may you may know what your problem is, but you don't know what questions to ask the AI to get the most
Right.
impact from it. And
To
I think
generate.
that's where people are run into with these tools. Oh wow, this has been Dr. Elise, so insightful. I think when you kind of think about the future of technology, this is kind of and where we're going with healthcare. Being immersed in all this is so important. You talk about this a lot of times, what your passions are on social media. Where can people find you, and what's your next goal? What are you trying to do next that you want everyone to know about for the future?
It's so interesting because you asked that question now, but you kind of led towards it already. One of the things that I've noticed has been a huge problem, and it's currently a big shift for me right now. When I'm in the office with one person, I'm just one on one, and I could give all that information. It's wonderful, but there's only one of me. And a lot of my information that I give to a patient is mainly education so that they can know the norms, and we could really debunk all of the incorrect information. So we're actually now moving to wellness workshops. So even when patients are unable to get in the room with me, now on demand, they'll be able to click a topic and I will pop up and start doing quick, high yield teaching of them understanding and knowing, one, what is true, what is not, what is correct information, what their baseline is, the warning signs, the red flags, when to turn off this on demand teaching and call me and make an appointment or get to your nearest facility. and it's going to be in different topics. And I love that we are able to do that because the number of individuals that we see that are suffering, it's growing by leaps and bounds. And it's a lot to do with one, many things. Trust, from the physician's point of view. Unfortunately, I'm part of a group of colleagues, unfortunately, that historically have abused, who have historically, unfortunately, I hate to say it, right, who have shamed,
Mm.
who don't understand the communication and the just community, right? The relationship that's there. And that has caused many individuals to do what we see right now, trying to find answers by themselves on their own. And that
Mm.
creates a huge problem. So that's one part of it. And there has to be just this reality of human touch that people are missing as well too. So the goal is with the wellness workshops, when we begin to see a growing view of a specific topic, then we'll be able to do breakout groups so that we can do live sessions with each other as well too. And then people to be really be able to connect with other people. We love what the world of internet that does. We love that we could have the entire world in our pockets, but we're still seeing more and more people are lonely. They are connected, but they're not connected to anyone. And what a lot of people don't realize, that is by far the number one reason that we see a lot of illnesses and diseases. Now, it may sound far-fetched, but it's not, because this has to do everything with our limbic system. It has everything to do with our nervous system. It has everything to do with what we saw in COVID, where inflammatory markers based on the American College of Cardiologists, inflammatory markers were being found in the hearts and cardiac tissue, something that they never saw before because of the isolation and the separation. We are humans. We have to be able to be seen, heard, known, spoken to, have an arm on a shoulder, and to know that someone is there. And while I could do that one-on-one, the goal is through our wellness workshops, people won't feel so alone. They won't feel isolated. And point blank, they'll be able to speak to someone that may even look like them. I didn't see, and I did not meet a Black physician until I was in a Black female physician until I was in my first year of undergrad. And I'll tell
Mm.
you, Theo, I signed up. I was at the University of Florida, I was in Gainesville, Florida. I signed up to be part of this mentorship program. And the very first day I went to that doctor's office, I'm going to tell you from my own, what unfortunately view of what a physician looked like. I expected a white man to come out. A
Mm.
Black woman came out, and I stood there and I was like, "You're a woman." She's like, "Yes." "You're Black." She said, "Yes." "Are you going to come in?" Theo, I don't remember anything else that happened that day. I was so inspired. My heart was full. I felt like I could do it because I finally, after 18 years, was able to tangibly see, touch, and speak with someone that looks like me.
Mm.
And
That's
that's
amazing.
all a part of the reasons why we have to utilize this technology that we have to reach the masses. And if you are like me, who believes in caring for everywhere and being the voice for the underserved communities, we have to get it to them where they are. We can't
Absolutely.
imagine and think that we have the answers without doing real needs assessments in those different communities. And when we started looking at more about, even over our video posts, as we were doing our quarterly reviews, that's when we realized, whoa, we're getting more engagement when we're doing these quick topics, these shorts of just, this is the illness, this is what to watch out for, this is what you need to do. And it didn't need to have the aesthetics. People just need solid, correct information. They're looking for it, they're hungry for it. And like you said, they want people to be transparent, they want people to be truthful, and they want to be able to have a testimonial, not even necessarily from the physician themselves, but from what they've experienced with people in their practice. That's enough sometimes. So there's a great work for us to do. I'm excited about these wellness workshops that are in the making right now. And we will be sure to, once they're ready to go, we're going to be sure to get them to you so that you could distribute it to your community as well too, because I know that you're providing them great information.
Well, thank you for that. Where can everyone find you on the socials?
On social media, it's Dr. Sabine Elisee across all the social medias, mainly Instagram, Facebook, DrSabineElisee. Again, that's DrSabineElisee.
Well, thank you for that. Everyone, please go see Dr. Elise's information and definitely hope you gleaned a lot of what's happening out there and how you can impact patient care for the betterment in your community or for the world. And so, as we look to change things for the future, please continue to listen to the podcast. We have other interviews. We get into the new normal of healthcare as we all try to strive for the better. Thank you for your time.
Thank you. I like that. New normal of healthcare.
Thank you for listening. If you like what we just talked about and you want to learn more, click either to the right or to the left, and you can find out more information about how we can help you this year.